substance abuse and addiction, environmental and cultural factors. The media portrayal of substance abuse and addiction is often two-sided with both being wrong. On one side of addiction, it is portrayed as cool. The media makes it look glamorous, with people going to parties and bars and clubs and having a fantastic time. They tend to leave out the hangovers and the come-downs and focus on the exhilarating lifestyle. The second way that a person with substance abuse and addiction is portrayed is as bad, weak, or flawed. It may show them facing a discriminatory attitude that may lead to fear of coming forward. Family support or lack of can influence recovery and relapse. When family therapy is included in rehabilitation programs, it can improve family function. With improved family function, families are better able to solve problems, build trust, set healthy boundaries, and improve communication. Learning how to reduce stress in a family can reduce the likelihood of a relapse. Family therapy suggests that a change in the family can produce a change in an individual. Negative peer pressure involves a group of friends or acquaintances asking someone to participate in something that is not good or healthy. The negative pressure can be hard to resist. Positive pressure is when people around you encourage positive behaviors. When people with substance abuse issues are surrounded with intoxicated individuals, they are more likely to use. When they are surrounded by sober friends, this can motivate them to stop using and lead to a healthier lifestyle. Um, 99% of our DNA is the same, but 0.1% variation is extremely important. The 0.1% is responsible for the variations in such things as height, hair color, and unseen traits such as heart disease, diabetes, and addiction. Scientific studies on identical twins, fraternal twins, adoptees, and siblings have found that as much as a half of a person's risk for addiction can come from their DNA. Just like with heart disease, addiction comes not only from a person's genetic makeup, but also from a person's environment. Children who are exposed to parents or other family members with substance abuse issues are at greater risk for developing addiction themselves later in life. Environment, such as school, home, and work, along with the availability and acceptance of drug use, can also affect a person's risk for addiction. Research has found that addiction treatment is just as effective when an individual enters treatment under legal pressure as when they enter treatment voluntarily. The criminal justice system in the U.S. has a variety of ways of dealing with nonviolent drug offenders. Offenders can be sent to treatment instead of incarceration, or treatment can be part of probation. The most effective models integrate the criminal justice and drug treatment systems. These plans include treatment, planning, drug screening, placement, monitoring, and supervision. The stigma linked with addiction and being branded a drug addict or an alcoholic can act as an obstacle to care, cost people their lives, destroy communities and families, and cause shame and despair. Because of the stigma of addiction, people will often wait to seek treatment. Seeking treatment and recovery should be a source of pride, but often because of misinformation and stereotyping, people are ashamed to come forward and ask for help. There are regions around the world in which populations are in danger or shunned. Addiction affects every country in the world. According to the United Nations, in 2019, 35 million people worldwide suffer from addiction or substance abuse disorders, but only 1 in 7 receive treatment. There are 14 countries that have outlawed alcohol in part or in the entire country. All the countries where alcohol is illegal have a majority of Muslim population. Iran being one of the 14 countries to outlaw alcohol, also in 2011 executed 509 individuals for drug-related charges. It is estimated that in 2016, over 5,000 people were on death row in Iran for drug-related charges, most being between the ages of 20 and 30, and most were first-time offenders. There are 35 countries that authorize the death penalty for non-violent drug charges.
Socioeconomic status affects health behaviors. Higher income may make substances easier to obtain. Some studies show that lower socioeconomic status is linked to higher rates of smoking and heavy drinking, while higher socioeconomic status tend to use marijuana and drink alcohol more often. Those with lower incomes may use substances to cope. Higher income and higher education groups tend to support the use of alcohol and marijuana. Socioeconomic status contributes to homelessness and unemployment as well. Racism and discrimination play a role in substance abuse treatment. There are several barriers to accessing treatment, including cultural stigma, poverty, access to health care, racism, stress, trauma, and socioeconomic disparities. People of color are often considered criminals instead of patients, even though drug use is similar between white people and BIPOC. There is a long history of harsher punishments and more incarcerations for people of color. Medication-assisted treatment programs are not equally accessible to everyone. It is easier for highly educated, higher-income white people to receive buprenorphine treatment through a prescription from a primary care provider. Methadone is often the only option in many Black Hispanic neighborhoods. Methadone must be supervised in person to be distributed, which contributes to disparities in treatment for BIPOC individuals. More than 70% of treatment centers in the United States use spirituality, higher power, and God in their programs. In 2001, the Joint Commission mandated that spirituality should be included in assessments by providers because they recognized its importance in healing to patients and families. Having faith and being involved in a religion has proven to prevent substance abuse as well as supporting addicts in their recovery through a sense of belonging. When it comes to alcohol and illegal drug use, men are more likely to experiment and use substances. Men are more likely to experience emergency department visits and overdose. Women react differently to drugs and are more likely to have cravings and relapse. Illegal drugs, including misusing prescriptions, marijuana, illicit drugs, and marijuana. Both genders are at risk for substance use disorder. Rural areas are affected by substance abuse. Factors that contribute to this include poverty, unemployment, isolation, lower education, and lack of access to health care. In rural areas, there is a lack of resources for treatment, prevention, and recovery. There are limited resources for detoxing and behavioral health, requiring people to travel to obtain services. In small towns, privacy is a barrier that contributes to people not seeking help because of negative perceptions. Telehealth and computer access would be beneficial in rural areas. It would allow patients to talk with a primary care provider or tour treatment facilities to find the best inpatient care when ready. Substance use disorder is often associated with negative biases. Stigmas can affect the quality of treatment by providers. Explicit and implicit bias were found to be similar. Implicit is thought to be a subconscious bias. Explicit and implicit negative bias were associated with phrases like alcoholic, addict, relapse, and substance abuser. Suggested terminology to decrease bias are person with an alcohol substance use disorder, education, and public awareness can lessen negative bias by changing the language currently used. Positive implicit bias is associated with terms long-term recovery and medication-assisted treatment. The United States has the highest number of mental health diagnoses, which is closely associated with how a society is doing overall. The U.S. has the highest suicide rates and second highest drug overdoses in comparison to 10 countries. Germany and Switzerland had death rates like the U.S. related to substance abuse. Less than 1/4 of primary care providers in all countries studied reported being prepared to handle substance abuse problems. The United States is a high-income country with low mental health and substance abuse treatment resources, resulting in many treatment gaps.
Those are our references.